Hi, guys. Welcome back for our daily practice question. It is day 325, and as always, I like to first start with my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. But before we get started, don't forget to hit the subscribe button so you're not missing any of my videos. And if you would like to gain access to my NP Test Success Toolkit, it is free and linked in the description. My website is also linked in the description and it houses all the resources that I do offer. And as always, y'all know I like to direct you to my business profile by simply going to Google and searching the Nursing Studio. It'll bring you here where you can find my contact telephone number, link to my website, and testimonials from previous review students. All right, y'all, question number one for today. A 54-year-old woman with newly diagnosed primary hypertension has no comorbidities. Her blood pressure today is 152/94. Labs are normal. What is the best first-line antihypertensive? Is it A, an ACE inhibitor, B, a beta blocker, C, a thiazide diuretic, or D, a calcium channel blocker? Take a moment and tell me what you got, y'all. Now, I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So here the stem of the question states, which is the best first-line antihypertensive? And this is the prime example why I tell you to look at the stem first, because it can give you everything that you need to focus in on. So here we know this is a treatment style question for hypertension and looking for first-line therapy for it. So I always tell you the first-line therapy options for blood pressure management are your thiazides, ACEs, ARBs, and calcium channel blockers, with thiazides being the captain, meaning if there's nothing contraindicating you utilizing that captain as a thiazide, use that first. So we have a 54-year-old female. She's newly diagnosed with hypertension, no comorbidities. So that means we can go with the thiazide. So C is your best answer. Question number two. A 62-year-old man with hypertension and type 2 diabetes presents for management. His urine microalbumin is elevated, indicating early nephropathy. Which medication is most appropriate? Is it A, a calcium channel blocker, B, an ACE inhibitor, C, a thiazide diuretic, or D, a beta blocker? Take a moment and tell me what you got, y'all. All right, so stem of the question here, which medication is most appropriate? So the stem is letting you know they're looking for a treatment. And I tell you, they're looking for a treatment, you got to run it back and see if they provided you with a diagnosis. And if they haven't provided you with a diagnosis, you got to run it back a step further and look and see if they provided you with, look and see those assessment findings so that you can determine what diagnosis it is, because we got to know what it is to be able to treat it, right? So we have a 62-year-old man with hypertension and diabetes, and we're looking to manage this. So we're looking to manage his high blood pressure. He also has a history of diabetes and his urine microalbumin is elevated. So this lets us know that he requires renal protection, right? So we know that's also factors that we include or consider, I should say, when thinking about hypertension management and which one to go for as a first line option. So when we are providing hypertension management and there is renal protection warranted, the ACE inhibitors and ARBs are the ones that we utilize. So here, B, an ACE inhibitor, is your best answer. And then lastly, question number three. An African American 70-year-old woman with hypertension also has a history of gout with 2 flares in the past year. Which antihypertensive is the best option for her? Is it A, a thiazide diuretic? Is it B, an ACE inhibitor? Is it C, a calcium channel blocker? Or is it D, an ARB? Take a moment and tell me what you got, y'all. Stem of the question states, which antihypertensive is the best option for her? All right, so the stem lets you know we're looking for a treatment and it's for hypertension. So we have an African American 70-year-old female. She has hypertension and a history of gout. She's had 2 flares in the past year. Remember, for the African American population, thiazides and calcium channel blockers are the best first line therapy options unless renal protection is needed, right? So we either go a thiazide or a calcium channel blocker. Well, she has a history of gout, so thiazides are actually contraindicated in patients with gout. So you want to go with your calcium channel blocker, so C is your best answer. All right, y'all. I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whoever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call. You can shoot us a text message or an email. And as always, everything that I do offer is linked in the bio of this channel, including my website. And as I mentioned previously, my website is also linked in the description of this video. All right, y'all. Y'all know what to do. Y'all make sure you meet me back here. Happy studying. Bye, y'all.